Welcome to part 2. Let's review common defense mechanisms, what they mean, and how they look in class and in clinical settings. Defense mechanisms are learned and mostly unconscious. They can reduce stress briefly, but they often mask the real problem. Think of them as mental pressure valves. Today, we will define each mechanism, show a class example, a clinical example, and give you mini practice checks. We will cover denial, repression, dissociation, rationalization, compensation, sublimation, regression, isolation of affect, and avoidance. Watch for cues like sudden tone shifts, flat affect, contradictions between words and behavior, or avoidance patterns. I will pair each concept with both classroom and clinical examples so you can translate them to practice. Clinically, we observe without judgment, name patterns gently, and offer choices. You will learn these by noticing them repeatedly in everyday interactions. Let's begin with denial. As we go, jot down one example from your life for each mechanism. Denial is an unconscious refusal to accept reality. Class example, a student failing says, "The gradebook is wrong, I'm passing." Clinical example, a new diabetes diagnosis is denied and education is refused. Denial protects the psyche when reality feels overwhelming. Extra class vignette. Repeated missed deadlines blamed on email glitches despite clear timestamps. Extra clinical vignette. A pack-a-day smoker claims, "I only smoke on weekends," despite charted packs per week. Cues include contradicting objective data, refusing results or minimizing impact, respond by validating feelings and offering one small step. Would you like to see how this meter works? Repression is unconsciously burying or blocking painful memories or thoughts. Class example, a student cannot recall a traumatic event that others describe. Clinical example, memory gaps about past abuse, but rising anxiety when it is mentioned. Repression differs from denial. The material is pushed out of awareness, not consciously rejected. Extra class vignette. On exam days, the student cannot recall the morning commute. Extra clinical vignette. After a traumatic ER visit, the client cannot remember triage through discharge. Cues, story gaps, somatic anxiety, and avoiding specifics. Respond by prioritizing safety, not forcing recall, and offering grounding techniques. Quick check, denial or repression. I never think about it. Plus, heart racing. Answer, repression. Next, dissociation and rationalization. Dissociation is feeling separated from yourself or from what is happening, like it is unreal. Class example, during a presentation, a student feels like they are watching themselves speak. Clinical example, after trauma, a client reports feeling numb or like they are outside their body. Dissociation ranges from brief detachment to more severe dissociative disorders. Extra class vignette, during an exam, the student loses track of time and cannot recall turning pages. Extra clinical vignette, after an upsetting call, a client drives home on autopilot and barely remembers the route. Respond with grounding, orient to present, use senses, and slow breathing. Rationalization is using a socially acceptable explanation to avoid the real reason. Class example, the teacher made it unfair instead of "I did not study." Clinical example, I drink because my job is stressful. Avoiding dependence. Notice the kernel of truth that makes rationalizations persuasive. Extra class vignette. The group project dragged my grade despite not contributing. Extra clinical vignette. Skipping physical therapy saves energy for healing while mobility declines. Cues, polished justifications and avoidance of personal responsibility. Drill, is this rationalization? I missed lab because the bus is unreliable. Answer, possibly, especially if the pattern persists without proactive planning. Next, compensation and sublimation. Take a breath and reflect. Which rationalization have you heard this week? Compensation is trying to make up for a perceived weakness by developing strengths in another area. Class example, socially insecure becomes a top achiever to feel valued. Clinical example, physical limits prompt extreme controlling behavior to feel capable. Compensation can be adaptive or maladaptive, depending on flexibility and impact. Extra class vignette avoids clinical labs but over-delivers on essays. Extra clinical vignette, with memory difficulties, the client becomes hyper-reliant on lists and routines. Respond by affirming strengths while gently expanding the underused area. Sublimation is redirecting unacceptable feelings into productive, acceptable actions. Class example, an angry student channels energy into training. Clinical example, intense anger is redirected to journaling, exercise, art, or support groups. Sublimation is one of the most adaptive defenses. Extra class vignette, test anxiety becomes motivation to tutor first-year students. Extra clinical vignette, grief is channeled into volunteering at hospice. Cues, energy clearly redirected into pro-social, goal-directed behavior. Drill, I box 3 times a week to manage rage. Sublimation, answer, yes, if safe and not harmful to others. Next, regression and isolation of affect. Regression is reverting to behaviors from an earlier developmental stage when stressed. Class example, pouting, whining, or a tantrum after getting corrected. Clinical example, a hospitalized adult becomes demanding, tearful, and helpless. Short regressions can be normal. Persistent patterns may need intervention. Extra class vignette, in group conflict, a student storms out and slams the door. Extra clinical vignette, after a new diagnosis, a client clings to staff and uses baby talk. Respond with structure, choices, and warm, clear limits. Isolation means separating emotions from the event, talking about something upsetting with no feeling. Class example, calmly describing a frightening accident with zero emotion. Clinical example, a recent assault recounted in a flat, factual tone. Here, the memory remains, but the emotion is cut off. Extra class vignette, after failing an OCE, a student says, "That was interesting," without effect. Extra clinical vignette. A client details only logistics after a miscarriage, avoiding emotion. Cues include precise details with noticeably dampened affect. Respond by reflecting content and inviting feeling if safe. As you describe it clearly, I notice it sounds heavy. Compare, isolation keeps facts, drops feeling. Dissociation detaches from the experience itself. Next, avoidance and quick checks. Avoidance is unconsciously staying away from situations that trigger anxiety or uncomfortable feelings. Class example, anxious about math, the student skips class and delays the required course. Clinical example, avoiding stores, crowds, or trauma reminders, and even appointments. Avoidance reduces short-term distress but maintains anxiety long-term. Extra class vignette, after a poor quiz, a student avoids instructor emails. Extra clinical vignette, misses follow-ups and deletes portal messages. Respond by validating, planning, graded exposure, and adding supports. Quick check, which mechanisms are these? 1, the test was unfair. 2, I do not have that diagnosis. 3, I felt outside my body. Take a moment. Answers. 1 is rationalization, 2 is denial, and 3 is dissociation. Practice. I did not need help. The nurses overreacted. Name the defense. Likely denial or minimization. Next, I am fine, while shaking and diaphoretic. Denial of distress. Consider isolation if affect is flat. Next, your nursing connection and closing. In nursing care, we assess stress and coping, recognize when defense mechanisms are overused, and support healthier coping, often by offering choices, providing positive feedback, and reinforcing progress. Pair observation with empathy. Name patterns gently and co-create next steps. You now have working definitions and examples of 9 common defenses. Next, we will connect these concepts to coping skills and patient teaching strategies. Thanks for learning with me. Jot one patient-centered phrase you will use this week to support healthier coping.